Suresh. Well, over the past few days, we have been seeing how Bengaluru has been reporting over 900 cases on a daily basis. And it is also said over the past 1 week, 60% of Karnataka's cases have been coming in from Bengaluru. And not just that, if you compare and if you see the tally, out of the 25,317 cases that have been reported in Karnataka, Bengaluru accounts for close to 10,561 cases. And that is a huge number. Even though in the starting phases, we did see that Bengaluru was not reporting so many and it had slipped down to the 4th position in Karnataka. But of late, over the past 9 to 10 days, the numbers have been steeply rising. Especially, the highest number was reported on 5th of July with 1,235 cases in Bengaluru. Well, speaking about these numbers, yes, 25,000 odd cases have been reported in Karnataka and Bengaluru as well. 10,000 odd cases have been reported. But everyone's been asking, is this the right number? Are the tests being done at a fast pace, and have the samples being tested at a right pace, as well as are the results being given out at the right time? Well, when all of these questions are raised, there is just one data which the Karnataka Health and Family Welfare Department has given. That is, out of the 81 labs which are there in Karnataka, which account to close to 10% of the labs in the country has around 793 labs, but out of that, 10% is from Karnataka itself. But even though 81 testing centers are there in Karnataka, only around 50 testing centers are functional. Now, it is said that over 44 government testing centers are there and 37 private testing centers are there. But even after all of that, only 57 testing centers are functional in Karnataka. Why is that so? Is it because the number of tests which are conducted is so low that they do not need the other testing labs, or is it because they are facing that shortage of staff as well? All of these questions rise at this particular point in time. So, to understand all of this, we are joined in by the chairman of Manipal Hospitals, Dr. Sudarshan Bollal, with us. Many thanks for joining us, Doctor. Also being part of the COVID task force. The first question is, the numbers are rising in the state at this point, Dr. Bollal. What do you have to say? Are the tests being done in a rapid manner, or is it that the tests are being done but the samples are not being processed, and that's why the results are not being given out?
Good evening. Good to be here. Thank you for having me on the show. As you rightly pointed out, Karnataka had done extremely well in the first few months of the lockdown. However, since the last week of June, there's been a significant spike in the number of cases of COVID in Bangalore and in Karnataka. There are multiple reasons for that. One obviously is after the lockdown was let down, a lot of people from other states which had a high prevalence of COVID-19 came to the state, and especially to Bangalore. And of course, the government has also ramped up the testing. So a combination of these two might have seen the surge in cases that we are seeing. Be as it may, I think it is important that we deal with it. And we'd also like to mention that once the lockdown was eased, people also let down their guard and started mingling freely. There were gatherings, social distancing went for a toss, and people were not wearing a mask. So I think all these reasons put together, the numbers are going up. But the government, along with the private sector, is working very hard to deal with this. And I must compliment the government of Karnataka for being the most proactive government, which started negotiations with the private sector. The Honorable CM himself has chaired multiple meetings right from day one.
Doctor, one thing, now around 31,000 samples are still pending. That is, the results are still pending. Is it that, the number of labs which are there, they are not functional or they are not equipped enough for the same? Or is it because there's a shortage of staff that, this kind of shortage or backlog is there?
I think there are multiple reasons. Of course, Initially, when we started, the number of labs were small, but thanks to all concerned, the number of labs have been increased quite significantly.
Correct.
Unfortunately, as was discussed in our recent meeting with the Medical Education Minister and the CM, the burden of testing has still remained with a few labs, especially at NIMHANS. I think there could be multiple reasons for this. One is many of the labs may or may not have had the personnel and the wherewithal to ramp up the tests. But this was brought up and has been taken up seriously. And I think all of us should share the burden and increase the testing, which is likely to happen very soon.
Absolutely. Now, also, we have been speaking about the 5 T's, and even Dr. Sudhakar was speaking about it. Earlier it was 3 T's, now probably it is 5 T's. That is tracking, tracing, testing was there. Now, treatment also has been added, and teamwork. Probably at this point, the teamwork is very necessary. That's what the task force also has been speaking about, because if at all the teamwork is not there between the private sector, the public sector, as well as the people coming together and working together, probably that cannot be achieved. So the 5 T's will have to be kept in mind. So if you can tell us how this 5 T's brought in, how that can be implemented as well.
See, I think the first 3 T's have been discussed quite extensively in the past.
Correct.
The 2 new T's, that is teamwork and treatment, is something that's really, really important now. I think it goes without saying that this scourge of COVID has to be battled with the government and the private sector working together. And I think that is already happening. The private sector, I think, has promised more than 2,000 to 3,000 beds. And also, from whatever I hear, close to 1,000 people are already admitted in various hospitals of the private sector. So the other point that was brought up was the treatment. And this is where we have very actively worked with the government. What has happened now, there's a general sense, which I'm sure you also have sensed, is that the hospitals are all full and the patients are turned away. The fact of the matter is that a lot of admissions that have happened to the hospital currently are patients who actually don't need to be in the hospital. They're either asymptomatic or mildly symptomatic.
True.
And in discussion with the government, we have now, the government has now agreed to do home isolation for the asymptomatic, of course, with certain precautions, and is also opening up COVID care centers where with minimal medical supervision, they can manage a large number of patients. This will automatically free up 60 to 80% of the beds that are occupied by people who are really not sick, blocking the beds for who are sick. This will also free up a large number of healthcare workers, because any maintenance of isolation in a hospital setup is a tremendously difficult task. A lot of people are needed, a lot of private personal protective equipment are needed. So if we implement home isolation, COVID care centers, and free up the hospital beds, I think we will tide over the crisis.
Now, Doctor, you were speaking about, the beds being set up. Probably we had never expected that the numbers will spike to such an extent where most of the hospitals will be full. So, yes, now we have spoken to many of the task force members as well, even the government for that matter. Probably they have been saying that they are well equipped with respect to tackling the surge in the number of cases. We have seen for now everything is merry, everything is fine. But in the coming days, if at all the numbers keep increasing in the same rate, because the MIT study has said that over 2.72 lakh cases will be reported on a daily basis in India in the month of February next year. So if that is the case, probably we will have to be more equipped, and probably we'll have to purchase more beds, probably ventilators is needed. Earlier we had seen only 3 people on ICU. Now we are seeing over 198 to 200 people on ICU beds.
Yeah. So you have raised a very important point. I think the fact of the matter is that the cases are going up on an average, maybe about 1,000 per day in Bangalore alone. But what I would like to sort of submit is that even though the cases are going up at 1,000 per day, a large number of these people don't require to be in the hospital. So it's we should not utilize a scarce resource like a hospital bed for the people who can be treated at home, which would be 60 to 80%. The second thing is, as the numbers are going up, there are also a large number of people getting better and going back home or going back to the work. So I think Bangalore has probably one of the best or the largest number of healthcare infrastructure among the many cities in the country.
Many hospitals,
many private. We have many hospitals, many medical colleges, private and government, plus fairly large government sector. So we do believe that we currently have close to about 7,000 beds, and that will probably be ramped up very rapidly to 10,000 or more. And if we maintain the policy of home isolation, COVID care center, and limited admission to the hospitals, we still would be reasonably okay.
Well, one important factor you did speak about, that is the medical colleges being there, and we have the largest network of hospitals as well. What we need to also understand is we have enough staff as well. That is, if you rope in the postgraduate students, if you rope in the interns, and if you get in, nurses, probably we are well equipped with respect to that. But you must have seen on the news as well that many of the doctors are taking to the streets and they are protesting over the stipend issue as well. Probably if they look at all of that and if they sort that out, probably we'll be sorted with respect to the entire medical infrastructure point of view.
So I think all over the world we have seen that when there's a pandemic or a rapid rise in cases like COVID, there is a shortage of personnel. In the US. You're probably aware that ophthalmologists, dentists, orthopedic surgeons, and everyone who's really not a trained physician have been employed in COVID care hospitals. So also in Europe. In India, we of course have a large number of doctors. Healthcare personnel would be a problem if we have a large number of hospitalized beds. And also we should remember that if a healthcare worker gets infected, not only he or she goes out of work, a large number of contacts with them who are also healthcare workers are quarantined. So hence we have to be very careful. One is make sure that the healthcare workers take all the precautions that are needed when they're working, so their risk of getting an infection is low. Two, please do not utilize hospital beds for people who do not need it. So this way we also limit the exposure of the healthcare workers to the infection and safeguard them and their colleagues from this. As far as the stipend is concerned, I certainly would not be the right person to comment on it. I think the government is already discussing that, and I'm sure they'll take the right decision.
Absolutely. Now, a million-dollar question everyone has been asking. Bengaluru has been seeing a large number of cases. Karnataka has been seeing a large number of cases. As a matter of fact, even India, over 20,000 cases every day. So have we reached a community transmission phase?
This is for the epidemiologists to say. Certainly the number of cases have gone very high, but I believe the epidemiologists and the experts in the field still feel that it may not be a community transmission. I will leave that to the epidemiologists and the ICMR and other regulatory bodies to decide.
Well, Doctor, lastly, if I have to ask you, now the number of labs we have in Karnataka is the highest in the country. That is, we have 10% of the labs here. We have a backlog of over 30,000. We are getting 1 lakh antigen testing kits as well. So probably we are well equipped with respect to testing more people, but probably the generation and the procedure later on, wherein you do the RT-PCR test and you give out results, probably there's a backlog in that. What would you like to say with regards to that? And apart from that, your message to the people as well, because at the end of the day, people also need to be well aware of what is happening, and probably home isolation you spoke about, they should be more responsible now and be more aware of the pandemic.
Very rightly said. I think we have enough number of labs. We probably should share the burden along with the main labs that are doing most of the work, which also means that we may have to recruit more microbiologists and microbiologists who are trained doctors, and also microbiologists from other fields could be roped in. And this is a suggestion that was discussed with the government. And with that, hopefully the number of tests can go up. We also have the rapid antigen test, which has been brought in, which gives you a quick answer in many cases. So with all these things, I think the testing part of it hopefully will be far better in the next few days, or at least in the next week or two. And the other thing that I would like to say before I give my closing comments is that we need to have a central repository, which I think the BBMP and the health department is working on already, wherein there is one nodal person and agency that has a complete data on all the COVID beds available, all the ICUs available, and there is a single
Well,
helpline
probably now I
number for
think
the
Tushar
patients to call.
Girinath has taken charge for the beds,
Yes,
and he will be taking care
yes.
of it.
Absolutely. I think that is a great move by the
Yeah,
government, because otherwise patients will be running from pillar to post, hospital to hospital
correct.
without knowing where they are. So here at least we can direct them to the closest hospital which has beds available, so that there is a much more regulated admission to the hospital. Anyway,
Absolutely.
my message for the day would be that COVID is here to stay. We'll have to learn to live with it. Let's not live in fear. Let's be aware of the disease. And like all epidemics, this too shall pass.
This too shall pass. Thank you, Doctor, for joining us with all of that input. Clearly, probably now it's time. At this point in time, we have all learned how to live with it, but probably we'll have to live a little longer with this particular pandemic. So probably all of you will have to start coping up. All of you will have to start being aware of it. On the other hand, yes, probably we'll have to start sharing the burden of the testing process as well, that we have the highest number of labs in a particular state of 81. So probably now if they start distributing the samples, and if they start ramping up the testing process and the process of doing the RT-PCR test, probably in the coming days we will not have any backlogs. Nonetheless, probably it's time that the government also starts mulling over it, tries to get as much data as possible, and also clear off all the backlogs, just to ensure that we know where we stand and what we need to do in the coming days. Well, though that was the session here, Dr. Sudarshan Balal as well, part of the task force, giving us an opinion on this. Well, all of you do ensure that you follow certain guidelines. That is 5 T's which are there: tracking, tasing and testing. Do work in teamwork, and the treatment will be taken care by the government. That's all in this edition of the Facebook Live. Thank you.